Hello all, I welcome you on the second day of Healthcare Transformation Summit with a successful first day and a very successful opening session of Healthcare Transformation Summit Edition 2. We are moving on to the next panel discussion, and which is about next-gen realities, IoT, machine learning, robotics, and artificial intelligence, cloud, and data center. And we have eminent panel with us for this session. As a moderator, Dr. Pankaj Gupta, HOD of Digital Health, Access Health Digital, and our eminent speakers, Mr. Dr. Sanjay Goyal, Commissioner for Health Department in Government of Madhya Pradesh. He has a wonderful presentation to showcase in start of this session. And we have eminent speakers, Mr. Rajiv Sikka, CIO, Medanta Medicity, Mr. JP Dwivedi, CIO, Rajiv Gandhi Cancer Institute and Research Center, Mr. Shubhankar Pramanik, CIO of Columbia Asia Hospitals, and Mr. Sharat Chandra, President of Government Blockchain Associations. So, just to start with, I asked Dr. Ravi Gupta to welcome all, and Mr. A.G. Prasad from Glenmark Pharmaceuticals, Vice President, who Glenmark is our platinum partner, to welcome all the speakers. Dr. Ravi Gupta, please. Okay, Dr. Ravi Gupta left. Mr. A.G. Prasad, can you welcome all of them?
Good morning, everyone. I welcome the panelists, and I thank Mr. Karthik Sharma for introducing the panelists and the eminent panelists that taken out their valuable time and for this deliberation. And this is a very interesting platform where a digital platform where the efforts put by Elets is to how to shape up the complete healthcare industry of this country. And the healthcare industry globally is divided into three major divisions. One is that a regulated market, the semi-regulated market, and the unregulated market. So the regulated market is US and Japan and Europe. They are the regulated markets. The countries like India, Indonesia falls under the semi-regulated market, and the unregulated, the Africa and Cambodia, and the smaller countries that are completely unregulated. But we are in a kind of transformation from semi-regulated to regulated markets, and there are a lot of things which are happening at the government level. The policymakers, the bureaucrats, the administrators putting a lot of efforts for this, taking us from a semi-regulated to regulated industry, because this is, as the saying goes, health is wealth, and the public health is the public wealth. So this was said by one of the eminent Supreme Court judge, Justice Lodha. In one of his judgment, he concluded while going for the procurement of the medicines, he said, "Public health is public health. Public health is public wealth." So it cannot be neglected. So now we are the leaders and trying to shape up India, and the catalyst role played by Elite is remarkable. And using this digital technology, bringing all the leaders together is a wonderful thing. Also, I welcome all the leaders for these deliberations. Thank you all for joining.
Thank you. Thank you, Mr. A.G. Prasad from Glenmark Pharmaceuticals, the platinum partner and the great support in putting up this show. Thank you so much. And now I hand over this to Dr. Pankaj Gupta with a request for a presentation by Dr. Sanjay Goyal, Commissioner for Health Department, Government of Madhya Pradesh. With your permission, Dr. Pankaj Gupta, and then handing over to you. And yeah.
Sure. Thank you, Karthik. Over to Dr. Sanjay. You can please make your presentation, and then we can get into a discussion.
Yeah. So thank you, Karthik. Thank you, Dr. Pankaj. So my presentation is very small one, just to initiate the discussions, because we in the government are probably the last ones to understand the importance of digital health in the health services. So I'll share my screen first. Just hold on. I'm not sure whether you are able to see. Just hold on.
Yes,
Yes.
yes, we can see that. We can see that.
Okay. Sorry, I think. Wait a minute. So I hope I am visible. My
Yes.
presentation is visible.
Yes,
Okay.
yes, yes.
Yes.
So we all have heard of uh, digital tech buzzwords, especially in the government. We are, as I told, last to hear these kind of words: AI, machine learning, Internet of Things, and others. But what do they really mean for public health? That is what my topic of concentration, because I, being the commissioner of health department and as well as commissioner of food safety and drugs. So we also need to understand, because that's why I wanted to be on this panel and wanted to hear from other panelists also. So is it just a passing hype? That's a big question to us, or is it going to revolutionize health in many unseen ways? So that is what we want to understand, that whether tech can impact health education around the globe or not. So the foremost question is, what exactly is digital health? So that is what we need to understand in public health. So it's a very broad term, which essentially means that we are using the technology to provide health services. It varies from medical services to public health services as well in the rural areas. So the services can include data collection, monitoring and aiding patients, analyzing trends, and making informed decisions to improve health outcomes. And as predicted that the global digital health market is likely to be about, someone says, like $500 billion by 2025. But at present, who are using it? It's mainly being used by like private agencies, organizations, non-government organizations, and they use vary greatly in type and scope. And one interesting example is the Zipline, a company which delivers blood and other medical supplies to remote hospital using drones, and it serves about 16 million people in Rwanda and Ghana. So we in Madhya Pradesh are also in the process of hiring such kind of services, because we have lot many far-flung areas, as most of us know that Madhya Pradesh is a large state, and there are dense forest areas also where it's a task to deliver services. So then presently, where is it being used? So it's being used in Madhya Pradesh also, and as well as in other hospitals across the country. So it is mainly used for hospital ERPs. We are in the process of acquiring further hospital-based management information systems. Robotic surgeries, yes, it's in clinical care and high-level hospital tertiary care centers. Some of the hospital heads are sitting here also. So where surgeons can control and operate on the patient while sitting on a workstation. This seems to be quite far possibility now for public health. But if we move on to other digital health media, the mobile health is most common. So that is where we can take the benefit of digital health using the mobile smartphone services. So smartphone apps are undoubtedly the most familiar use of public health, digital health, and it is understood to be very easily delivered in our government department. So, due to wide availability of smartphones now, with almost every healthcare worker having it, and then there is good bandwidth available in rural areas also. So, they are perfect for giving feedback, then reporting of data, and then for communication. So today we are seeing the rise of apps even for fitness tracking, finding any assistance, obtaining information, and then increasingly these apps are being used by healthcare workers also, and it's not limited to consumers alone. So, and also we'll talk about slightly about the microcontrollers, because we see these sensors picking up data, and these are small low cost programmable device which run everything from any biomedical machines, from MRI or CT to blood pressure devices. So they are being used in innovative ways to collect data and then inform, then convey the decisions also. So Internet of Things enables us to connect these devices automatically and communicate and coordinate with each other in real time. I think even everybody knows is being used to monitor immunization cold chain. in our states, especially in Madhya Pradesh, have been leading in establishing even through the help of UNDP. So robotics, yes, it's going to be in, though in a small way. So we are in the process of using automatic prescription vending machines. So one organization which has installed some of these kind of equipments in Madhya Pradesh, and we might be going for using of sanitation robots for hospital cleaning services. So wherever we can probably make it low cost and high quality, we will probably be venturing into this area in Madhya Pradesh. So, as everybody knows, artificial intelligence is being undoubtedly the most common, the most popular tech phenomena, which is going to be in use in future, especially in states like Madhya Pradesh, where there is a shortage of human resources, especially in interior areas, where algorithms can help us in diagnosis, maybe in making referral decisions, and also in giving treatment options to our healthcare workers who might not be so much trained or qualified. Apart from predicting prognosis of the patients, it can also be used by public health departments to predict disease outbreaks. Like everybody knows how Kerry Institute used machine learning to identify the bat species carrying Nipah virus in India. So now let's see the how these technologies can be integrated together. So first, as everyone knows, like the input comes through smartphone or microcontrollers. It goes to the cloud where analysis or algorithm can be hosted. Then after processing, the output is sent to the data center controllers or smartphones for the final use. So, but apart from this, there are a lot of challenges, especially in public health and in government sector, because we have to deal with the number of ethical, technology, and operational issues, and uh, this will not make the task easy for us. So many people point to the sensitive patient data, for which we need to have privacy preserving algorithms and then the security uh, protocols in place. And then there are many remote and rural centers where we do not have good wireless broadband bandwidth, and the penetration, though, is rapidly increasing. That is what we are optimistic about. So finally, the personnel have to be trained. The operational feasibility is the most difficult part, even though we are in the process of technology reforms. So, but making our healthcare workers and the communities uh, to be comfortable with the technology is going to be difficult for us. So finally, the key takeaways, there are only two things which I need you to take from this presentation. That a lot of progress has been made in different types of uh, digital health initiatives, but still there are obstacles which need to be outcome so that we gain the momentum to break even more challenges. And the digital health definitely has huge potential. We must continue to encourage new ideas, especially in government sector and public health departments, and support innovations if we want to revolutionize healthcare services delivery forever. Thank you so much.
Thank you, Dr. Sanjay. This is wonderful. You set the stage actually for the discussions. And coming from a person sitting in the government, we as an NGO work very closely with the central government. And we've seen the kind of changes that are coming in under the leadership of Modi ji, and National Digital Health Mission coming to life, and then all the standards being sort of rolled out. A lot is going to happen in the near term rather than in the long term. So thank you very much for enlightening this entire group.
Thank you.
Um, sure. So now getting into a little bit more of the discussion mode on the topic. I sort of label this entire area as, I call it SMSE IoT Blockchain. So just to sort of understand, so SMSE, S stands for social media, M is mobile, A is artificial intelligence, C is cloud, IoT and blockchain. We all understand that. But I just came up with this acronym so that there's a lot to be discussed in this, and then we sort of forget as to which is what. social media and mobile, really nothing much to talk about. It is our daily life now. So that's really, we are living with mobile and social media in our pockets. Cloud, at one point in time, it was an aspiration. Today it is reality. We've gone away from on premise. We have moved to a cloud model, which is pay as per use. So there is no longer that we are going to be putting a server in our office. So all of us have sort of pretty much gone away from that. And the cloud has also become an elastic cloud, that you really don't have to go and tell them this much of space I want. So you can start with X amount of space and it will elastically grow based on your usage. So we sort of assume that this is already there. Mobile, there was a time when schools did not allow the mobiles, and today the school is inside the mobile. So that is the kind of change that has come in. And COVID has been an accelerator in adoption of all these technologies. So COVID did not break the healthcare system, it only exposed a broken system. And then it has been an accelerator, and a massive accelerator, at a proportion that is unimaginable. I mean, we could not have imagined the kind of acceleration it has caused in the adoption of all these technologies across the globe. So I'll cite some examples just to sort of stir the thinking, and then invite comments from everybody. So I was listening to a HAS20 conference that recently happened in Salt Lake City, Utah. It was a virtual conference this year. And the luminaries that were talking about, they said, they've used artificial intelligence for better projection of, in terms of how many beds will be required and all that during the COVID times. They have used it for prediction in terms of which patient should be admitted and which patient should go home. It is being used for better detection in terms of detecting whether the person has the disease and which stage of the disease it is, what kind of intervention will be required, and even planning the intervention in terms of whether antivirals or dexamethasone or anti-inflammatories have to be given. So they have found that it has, AI is doing better as compared to all of us humans put together. Usually this kind of a change would have gone through a medical board, and the medical board would have deliberated the data and everything before implementing it and saying that good to go in terms of implementation. But what COVID did was, COVID just short circuited this process. And there was a shortage of clinician, there was a shortage of bed, there was a shortage of resources. So they straight away went into implementation of AI in the clinical use. And AI has done better in terms of saving lives. Now it is, although we as humans don't understand how this AI is exactly working, but it is saving lives. Now how can you stop it? So it's a reality. It's no longer that it will happen. It has already happened in the last 6 to 8 months. So with that thing on the table, I will invite comments. So let us first talk a little bit about the least talk topic about amongst all of this, which is blockchain. Now, blockchain, mostly people associate with cryptocurrency, but cryptocurrency is not the only thing. It's a distributed ledger, and it can be used for registries, it can be used for electronic medical records, and so many other applications. So first of all, we'll go in a round robin fashion. We'll invite comments on blockchain, and then we'll go to IoT, and then we'll go to artificial intelligence, which is the favorite topic for all of us, I know. But then I'll keep it for the last, so that let's sort of do justice to the other two also, which is blockchain and IoT. So over to Sanjay ji first. If we can invite your comments on the blockchain.
Yeah. Thank you, Dr. Pankaj. So for the blockchain, definitely. So because I have joined the health department 4 months back, but I have worked on the blockchain project because I before going to Johns Hopkins for doing my masters in public health. So I was managing director of electricity company of the Madhya Pradesh. So we were thinking about, because we have all sort of consumer data, and then every month we do the billing of the consumers. So in that particular project, we were going through thinking about having the option of blockchain. As you said, it's a distributed ledger, so it makes us comfortable because nobody can access the data, nobody can maneuver the data, anybody can have access from anywhere. So there are a lot of advantages of putting big data on blockchain, and especially it has to be accessed at several points by several individuals. And then as you said, like cryptocurrency, because then you can actually validate and secure the data also in a way that's inbuilt into blockchain. That is the most beneficial part of it. But yes, as I told you, in the government, so you slightly work behind the schedule in comparison to others. So the kind of acceptability which you need to have for such kind of innovative things is very low. So government decisions are made by so-called bigger technical committees, which have all sort of traditional people who do not like to read a lot and what is there in what is the latest. But I am sure that we as a government, we need to come forward. As I said in my presentation, we need to come forward and support such kind of innovative ideas, because if government comes and supports such ideas, I think it can really give a push to it. So I am in favor of blockchain because it costs less, it's more secure, it's easily accessible. That's what my understanding of blockchain is. Thank you.
Thank you, Sanjay ji. Going to Sikka ji, Rajiv ji, if you can sort of, put your comments on the table in terms of blockchain.
Sure. So, let me give a two perspective to this. One with respect to Medanta, or hospitals who have distributed point of services in any location. So Medanta, have roughly 4 hospitals which are up and running. Plus there are few which are coming, and we have roughly 6 more small clinics which are in the periphery of those main hospitals. So fortunately for us, we run single instance of our HIS and other application, which means that single source of truth with whatever security is available to each and every users who are using those system through proper authorization and authentication. But in a larger context, so for us, the blockchain as a use case has less relevance as of now. But when you talk about blockchain in a larger context, especially let's take a simple case of NDHM, okay, where government wants information to be shared between various stakeholders in the care chain, right from the primary healthcare to diagnostic labs to secondary to tertiary to ambulance. In this particular case, information has to travel from one source to another source. We don't know whether information can be, as rightly said by Dr. Goel and also by you, in a it's nothing but a distributed ledger, and ledger is nothing but for me certain data elements which are required by a clinician to see what kind of procedures or diagnosis has to be carried out on a particular patient, or what kind of medication has to be carried out. So if for whatever reasons, information, because human health changes, information is getting changed at one place. So immediately, without worrying about, what other systems have to be updated for this particular critical information about the patient, you don't have to worry about that, because that's where the beauty of, distributed ledger is. And also, as rightly said by both you as well as by Dr. Sanjay, is that it's fully secure, because the kind of encryption which is built into the ledger is remarkable. So you don't have to worry about the security aspect. So I think this is a very fair and very relevant technology, especially when you talk about availability of information across value chain in the healthcare, and knowing that NDMS is on the verge to get rolled out at any level.
Sure. Thank you so much about your comments. And definitely what I would say is that blockchain is something that can probably be used, like looks like the consensus is emerging that the healthcare documents could be sort of connected by using blockchain, and we can come up with a document registry which will be across different facilities. It will have pointers to the various documents, healthcare documents sitting across the ecosystem, but then connected by using a blockchain based model. So that's the sort of thing that seems to be emerging. And Shubhankarji, if I can, invite your comments on it, and then, we'll go to JP Dwivedi.
Yeah, morning to all of you, basically. First of all, we have to think what is blockchain concept is, basically. Blockchain is like you are sharing your information to third party with 100% secured manner without copying the data. Basically, you are not conventional copy and paste data, rather than you are giving a secured connections, and that your third persons can see your data. So this is the basic concept when you are going for digitalizations of your healthcare, patients records. Basically, patients records is very touchy things, and it's a very you can say it's a very confidential data for the patients itself. Initially, this data belongs to a particular organizations, particular hospitals. Now this data is for the patients, so you have to secure his or her data in a manner where no other than the patients can access that data. So blockchain concept came, and blockchain basically applied on those sharing pattern of those data. So definitely when we are running multiple units of hospitals, first of all, we have to check ourselves, our data, our patients' data should be secured in our territory at least first. Then we can go for the global concept. By sharing this data, and definitely we have to give this data to the patients in a manner, in an encrypted manner, some technologically fit data to the patient, so that patients can show this data to the others healthcare provider also. So this is the what I mean to say blockchain concept came in our industry.
Perfect. Thank you so much. JPG, if you can sort of enlighten us with your thoughts in terms of blockchain, because I've always seen, very innovative thoughts coming from you. So let's listen to you, JP. You're probably on mute.
Can you hear me now?
Yes, please.
Yeah, thank you, Pankaj. First of all, I would like to express my pleasure seeing Dr. Goyal here, because my native is in Bundelkhand. So that is very close to the MP border. Well, my native belongs to UP, but my childhood has been spent on those difficult terrains, walking several kilometers to attend my primary and secondary education. Now people in MP government talking about these sorts of technologies is so heartening that I see something that is kind of dream to anyone. So with this, coming back to your question, see, I'll give you a very simple example. Somebody wants to send $100 from California to my village in Bundelkhand. Now what happens? One banking transaction will be initiated in California, then it will probably go to New York, then it will go to London, then it will come to Delhi, and then it will go to the bank in my village. Now ledgers in these particular organizations will be updated, transactions will be entered, some sort of procedural delay will happen, and certain fees will also be paid at every stage. So this $100 will come down to $93 or something like that. With blockchain, now imagine everybody accessing one single document, and any update or entry into that transaction is being verified at every stage by all the stakeholders together. That is what essentially blockchain is. I just explained this in financial terms. The same happens in healthcare terms or any other usage. All that I know about blockchain is that everybody is trying to do pilots in this. There are very few real-time uses. I read one book by Jasprit Bindra. It was written in November 2016. He's tech evangelist in Mahindra Group. And at that time, he said he knows only 3 startups which are kind of exploring blockchain in the country. And he knows only 12 blockchain engineers who can really code there.
Mm.
So it is as recent as that. All these developments have been made in past 3 years only. So very nascent technology and very promising. In healthcare, I think this is most promising because all the three birds will be killed in a single shot through a single stone. That is the confidentiality, the integrity, and the availability.
Mm. 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 Wonderful. This is really
So I hope
interesting. Yeah. Go ahead.
I hope I answered your question.
Yeah, absolutely. Spot on, actually. And it actually sort of started a thought process in my head that, confidentiality is been a major issue which has been discussed in terms of data privacy, data security, and all that. And if we can bring in blockchain to solve that issue in terms of healthcare data, in terms of healthcare documents, and probably take it forward in terms of an indexing system, so maybe there is something that is emerging, and more discussion may be required to sort of arrive at it. And but then this forum has given us a direction, and that's sort of a thing. Moving on to IoT, now as far as healthcare is concerned, it is being called medical IoT. So it's called so sort of Internet of medical things. Instead of Internet of Things, it is Internet of medical things. So when we say medical things, these are devices which used to be standalone devices at one point in time. They were all sort of separate. There was a time when you would treat device, which is a medical device, medical software, and the services as separate components. No longer, the lines are beginning to blur. So there is hardly any medical device company that does not bundle the software along with it any longer. So now you will find that entire thing as a bundle that is being sort of released. And not only that, the service component is also there because artificial intelligence is also bundled into it. There are latest machines which are not only IoT based, but it also comes with an application attached to it, which is able to sort of diagnose and even go one step ahead and give you the solution. So let's sort of debate on this area and see what are the latest things that are emerging. All of you are on the field, so let's do the reverse this time. Let's go to JP and ask in terms of what do you feel about IOMT, so to say, the new terminology which is emerging.
So it's great you have asked about how I feel. See, it has very huge plus and very huge minus. We are very excited and very scared, tell you honestly. It has really breached into our personal being. Say, Atma mein pravesh. So it has gone so. How many steps I have walked, who all am I meeting, where all I have visited. Very strong intrusion into our life space. Second, these are all hugely using the technologies like Bluetooth. We don't know how much radiation is being produced. People are talking about dangers of the 5G already. So we really totally don't know how much bad it is going to do for us. I will start with the negative aspect first. Of course, positive aspects are phenomenal. There is a device which is actually measuring, taking care of us, taking us from health repair arena to healthcare arena. Right now, what all are we doing? And I have been talking about this for long. We are not doing healthcare. We are actually doing health repair. When something has gone wrong, we go to the hospital and damage control starts. So these devices proactively, do the event management rather than incident management. If you talk of ITIL terminology, so certain patterns are developing in the body. These devices are proactively reading. There is a prognosis that something is actually simmering, something might go wrong in near future. and something if really needs clinical intervention, probably these devices are interconnected. Some command center hooter will buzz, certain hospital will be activated, some ambulance will come, and without my knowing anything, I'm still feeling I'm fit, hale and hearty. They will put me into ambulance, and by the time my heart is going to do something on me, I'm already on the stretcher and somebody is taking care of me. So these are strongly positive aspects of these Internet of Medical Things.
Wonderful. Actually, I read a report that one of the ex-vice presidents of US underwent a surgery to make sure that he switched off the Bluetooth and the Wi-Fi capabilities of the pacemaker that he had, so that nobody could, sort of hack it. And if a vice president of the country sort of, fears it, imagine, and that to a country like US. So he underwent a surgery to get it switched off, and that is the kind of data security concern that people have as far as IOMT is concerned. And I think these are genuine concerns, because there is pretty much no device that is not hackable. So given that, I do understand your concerns about the bad aspects of the IOMT that we have to be careful about, and maybe there is a regulation and there needs to be more thinking that has to happen in those areas. So moving to Shubhankar, would you want to sort of enlighten us about your thinking on IOMT? You're on mute, Shubhankar.
You are on mute, Subhash.
Yes.
Can you hear me? Okay. IOMT definitely is very excitement for IT persons who are in healthcare industry, basically. Definitely, we are like to work more on IoT. The background of the IoT came, I just elaborate a little bit. The background of the IoT came when we saw some statistics like if we go for patients' records for any hospitals, we can see almost 20%, more or less 20%, 25% patients are coming to the hospitals just you can say walking 5 kilometers away from their home, their houses, basically. And they're not the your business region. I can say it's a business regions for particular hospitals. So this is a very true picture of as of now in India, and you can say almost 8% in our population are increasing towards 60 plus category of the populations. And these two factors, and more of all, another factor is in the COVID we have seen, as you rightly said in the just starting of this meeting, is a shortage of medical personnel also. So these three backgrounds makes us it takes us a wise decision that we should go for the IoT things, basically. Because at least if we are not giving the, we can say, remote care in our rural health area, we can start thinking to start some sort of patient's care through using this kind of devices. Basically, it's a devices which you can take data from your remote area to your tertiary care hospitals. So at least we can start these things to take care of your patient's care. If I give some examples, like in IoT in healthcare nowadays, we are using like headsets that measures your brain waves. Nowadays, I have seen some clothes with sensing devices, basically BP monitors, glucose monitors, ECG machines, even some tissue embedded sensor also, like your pacemaker kind of things. So this data is coming to your tertiary care hospital, so that you can reduce at least which, as per statistics, 24% your emergency death also. So definitely, it is a very positive things for healthcare industry also, and very excited for healthcare IT at least.
Wonderful. So you touched upon a very interesting aspects about biofeedback, and in terms of there are headbands which are emerging, which
Yeah,
sort of measure your EEG, and based on your EEG, it is able to play music and
absolutely.
change your mental state, which has a huge benefit in terms of mental health, but also on children who are special needs children, and a lot of experimentation is being done. I personally follow that space a lot, and I've been watching the kind of developments happening in that space. Wonderful.
I can give you, I can give you an example. Just in West Bengal, there is a veteran actor named Soumitra Chatterjee who was already infected a corona positive case. They are giving the music therapy. You can. He is very much fond of different kind of music, and it affects basically.
Definitely it does, because ultimately brain waves and music waves, if you play the right kind of music, you can reset the brain to a certain different state, say from awake state to sleeping state, and
Yeah.
vice versa. So wonderful. So Sikaji, if we can hear from you in terms of IOMT, and then we can go to Dr. Sanjay.
Sure. So, my understanding of IoT first. See, whenever it comes to repetitive tasks and at very high frequency, attention to accuracy is always a challenge.
Right.
This is given. And when humans are involved, it is very, very difficult to gather, process, analyze this information in almost real time is difficult and definitely prone to error. And when it becomes, relevant to healthcare industry where tolerance is not at all acceptable, and we call it as a zero tolerance zone, then there is, more and more caution has to be done. Let's take a simple case of, ICU, where we have a lot of vitals, be it pulse, BP, glucose, oxygen saturation, and coming out almost on a second basis or a per minute basis. You can't expect somebody to keep gathering this information and make sense of it. While if you we all know this, that the devices which are there on the bedside as a bedside monitor, they have the capabilities to capture this information, and these are there for probably a decade or more. So which means the devices were there which were streaming this information or collating this information from the human body on a per second basis, while we were not having the capability to make any sense of it. And the only sense we can make is that we start pulling this information through some manual intervention and make some trend out of it. My personal opinion is that humans are lazy, and engineers are super lazy, and I am one of them. So what happened was that engineers probably thought that machines are throwing this information. Then I have a DB which is also capable of probably recording this information at a per second basis. So why not have these two devices talk to each other? And that's where the genesis of IoT comes into picture. So it's like necessity is the mother of invention. Probably laziness is the mother of IoT. That's my understanding of IoT on a lighter note. But there are no dearth of examples. JPG has already talked about the huge minuses. So, but I'm of the strong opinion that some of the minuses with respect to security, with respect to confidentiality, with respect to ethical use, with respect to healthcare, those can be addressed. But when you talk about, and Shubhankar take an example of 5 kilometer, but the stat is that 50% of the people have to cover more than 50 kilometer of distance to reach a secondary care hospital or facility. This is a known published information by NITI Aayog. So we are talking of that kind of accessibility of healthcare to common man in the country. So with IoT, especially in the public healthcare, when we talk about, we can have chronic disease management, we can have preventive healthcare, and in a tertiary care, ICU supervision and remote patient monitoring are super examples. We are already using IoT-enabled services in a mobile, which means that senior doctors don't have to be in ICU 24/7. Whatever is there on the central bed, on the central monitor, which is getting feed from each bedside monitor, is available for a doctor on his handheld device. So, which means that all those graphs are getting, they are pulling information through IoT devices. Some are wired and some are them on the internet and getting feed on a mobile device. So IoT, big data, and mobility coming for doctors to take critical steps and decisions are there in Vedanta at least for 3 years now. So this is my understanding, but definitely there are challenges which, according to me, can be addressed easily.
Perfect. So you actually talked about using IoMT in the field in terms of primary care and public health, and that's exactly the area where Dr. Sanjay is working. And I personally believe that at the point of care in primary care, the devices, if they are hooked up to intelligent network, then this can create a revolution of sorts in the healthcare that has never been seen before. With health and wellness centers coming up, I think that's a perfect setting for making this happen. So Dr. Sanjay, if we can hear from you in terms of what do you think about this area?
Yeah, thank you, Dr. Bankaja. I must thank and appreciate Rajiv Sikkaji, because he has beautifully delineated all its potentials and mainly the concerns part of it, and then he is having so much of idea about potential of IoT to be used in a primary care service delivery. So thank you, Rajiv ji, and I'll agree to JP Dwivedi sir's comments also, and I do not have nothing. I don't have much to add upon, but yes, so I'll say like IoT along with IoMT. So because we have deliberated upon using it and making things comfortable for us while delivering health services in lower source settings. So the problem which we experience is that there are no standardized protocols. Like, so all the machines that in case they need to talk to each other, so they have to be on the same protocol used for the microcontrollers, because it's normally microcontrollers who take data from sensors and push it to internet or some Bluetooth and some other. Definitely the end point may be a smartphone device, smartphone or other platform. So the interoperability of different machines and they not being on a single protocol is the problematic part of it. So as you said, there's a lot of potential with the health and wellness centers coming up, and the telemedicine. There's a legal acceptance of telemedicine in our country. So thanks to, as you said, like COVID has also opened some of the areas for the future, which is a positive part, especially for our primary care service delivery systems. So though it has opened so much of area, the telemedicine, but again, I will like that if there is a consultant sitting on far end, maybe in capital city Bhopal or some other metro city. So now I need a worker who can connect the device and then read things for me, tell me the readings, everything. So similar to ECG or something else, if I tell them just to connect the thing and I can see it on my device, maybe mobile or computer, so that's going to aid a person who is sitting far away. So it makes my life easier as a health administrator, because it can create multiple service points like health wellness centers for me. So yes, IoT also, apart from IoMT, where two medical machines talk to each other, IoT also has a possibility like I can monitor the temperature of all SNCU and humidity sitting at one point, and then either the system can automatically switch on something far away, or I can put one person on the job who can take those alerts and then start those machines so that I can maintain temperatures, humidity at labor rooms and natal centers. We had one experiment. We conducted one experiment for monitoring the maternal health from a faraway center. her fetal heart rate, BP, pulse oxygenation, so as to make decisions about going for cesarean section at the earliest stage. So, but we were not successful in getting it implemented. As I told you, there are a lot of operational and technological concerns and the training part of it. So, but like as a pediatrician, I always used to think about whenever I used to get a call, because I am a pediatrician. Sorry to let you know. So I am a pediatrician by qualification. So whenever I'll get a call in the night from gynecology, so obstetric department, then in the night, especially in the cold northern area, so I will always, like, as soon as I get the call, I shall be able to switch on the neonatal corner heater, because otherwise by the time I just go directly to the operation theater, pick in neonate, they bring it to that corner, it used to be so cold, right? So then, like, things like these, I can, from my mobile, I can switch on the heater for the neonatal corner about at least 5-6 minutes before, so that it gets heated up before I put the infant neonate on that. So those are small things. Yes, the wearable devices are going to open up a huge possibilities for us, especially in primary care. Though, as I said, governments are going to be the last ones to accept such kind of things. And given I also agree with the concerns raised by Sikka sir and Dwivedi sir. But yes, if we can control those things, we can limit their disadvantages. We can make use of wearable devices also, and apart from some other things. So I see a huge potential, but yes, I also have concerns similar to the one raised by other panelists. But I think with the help of technology experts, we will be able to take benefit from technology revolutions. Thank you.
Wonderful. In fact, you've sort of given use cases that many are very innovative in terms of your pediatrics experience. And if you can continue in terms of artificial intelligence, and we've already sort of alluded to AI in many ways while talking about blockchain and IoT. So if we can hear your thoughts on AI also, and then we can invite
Yeah.
others to talk about.
Sure. Thank you so much. And sorry, like I'll take way less time. So AI definitely, as I told, MP in particular, as everybody knows, Dr. Dwivedi is from almost similar area like Madhya Pradesh. So there are hardly any qualified and experienced resources available, right? It's a difficult, like, I will start from the example of making referral decisions, right? That's the critical part. So let's choose about the maternal, like the natal cases, where I need to make referral decisions, when to take the patient and where to take the patient, right? So now the decisions are mostly made either by the family members or by the driver of the ambulance, right? So the EMTs, though we have told them some do's and don'ts, but they don't understand the full algorithm of taking the patient to some specific place. So now we are in the process of, we have created those variables, right? So now with the use of artificial intelligence, what I can do is, so my best physician, my best obstetrician, I can choose 4 or 5, which I am doing now. So 4 or 5 people, give them different instances, the real life instances, and then train my algorithms. So as per their understanding, which is of the state level, and then that algorithm will be put on the cloud, right? And then simply the drivers are expected, so-called, if the driver or the family member or the ASHA or ANM, they are expected to only input those variables which are simpler to be asked or noticed, like heart rate or some other thing. So then the machine is going to give you the decision. If in case says, so she needs to go to district hospital directly, right? So then they'll have fair idea. So, or she needs to be immediately taken for cesarean section, or she needs blood transfusion, right? So maybe then it will give you an idea of the facility where to take the patient, because now what is happening, In many deaths, we have realized the patient is first taken to a PHC or CHC level. So then after some time, the nurse or the doctor come and then they ask few variables again. And then they say, no, we can't manage this patient here. Take her to some other higher facilities. And the crucial time gets lost. And the ambulance wala, the 108 and journey ambulance wala also leaves immediately after dropping the patient. Then you have to again make a call, and there is half an hour response time again comes into picture. So the again patient is sent to higher facility. And similarly with the use of IoT, so as soon as they input the variables, accordingly the concerned facility will be alerted and informed so that they can prepare accordingly. So like I see, yes, there are many ethical issues which are going to arise with AI, mostly the legal part of it. Then who's going to be responsible for the decision? So now we are thinking about not as AI as an independent decision making, but it will certainly augment or be helpful in making the decisions. The decisions are still going to rest with the person, maybe with the patient or the physician sitting at some other place. So we are still deliberating. That's what I told you. This is just one project on which we are deliberating. I don't know what is going to happen, but I think the panelists and other experts, that's what I am here for today, that I like to invite everyone. If you want to work in Madhya Pradesh, so please do come and please help us in bridging those gaps. Thank you so much.
Sure. Wonderful to hear that. In fact, what you talked about, the ethical concerns, and those are really the ones that I heard in the HAS20 conference that I mentioned. So there were doctors who are working in large medical centers in the US. They said, this AI is saving lives, so I can't stop it. But how is it really doing it? I do not know. So is it making the right decisions? I do not know. But I have to rely on it because it is a reality. So it is a lot of ethical concerns, definitely right. So we'll just jumble the order in this discussion. So go to JP and listen to him, and then sort of go to the others. So JP.
Thanks, Pankaj. So in my opinion, going theoretically, AI is actually a canvas. It is a platform on which beautiful pictures are drawn. Artificial intelligence is a broad spectrum. Machine learning is one use case that basically builds upon AI, and then comes deep learning. Robotic process automation is another area that is of AI. The recent phenomena is IoT and then IOMT. These are all specialized cases of AI, if you like it.
Mhm.
When we were students, in 1980s, AI was emerging. There were just a couple of books and a very few papers available. But now AI is so deep into our lives. If I buy a kind of diaper for my uncle, I will be flooded with the emails and different WhatsApps and ads that, hey, by the way, these diapers are available at cheaper rate. I wonder how these guys are coming to know about my needs. So there are personalized kind of video recommendations and anything, YouTube. So they know all about what your choices are, what your needs are, what your requirements are. We just need to use it properly. As you said very rightly, it is working for us. We just need to control, direct, and make a proper use and prevent it from going into the wrong sides. This is all that I would say.
Sure, wonderful. This is really interesting the way you put it. So Shubhankar, would you want to add to that?
Yeah, as you told rightly that in USA now artificial intelligence is saving their practices, saving the patient's life. In India, at least, it saves a time. I can say, doctor is used to see 60 odd patient in 1 hour, almost 30-40 patients in an hour. So it's a artificial intelligence is a kind of algorithms. If you put these algorithms before the visit of this doctor, so you can increase your number of patients in a particular periods also. It's just for examples I am giving you. Like JP Dwivedi also told that if I search anything in my Google, automatically the same kind of you can say search results will come in others websites also whenever you will go. Even if you can see on Netflix also, if you see a particular picture kind of pictures, and then Netflix will recommend you that since you have visited, you have seen this picture, so these are the you can say you can have an interest on those pictures also. So it's kind of algorithms, definitely artificial intelligence. And India is just maturing this area, since the pattern, the kind of variations in the practices are so different in even in an organization's a particular specialty. Two doctors can see a patients in different ways. So the pattern and variation is so different. The algorithms set for a particular specialty is very difficult. So it will take time, but it is definitely it will reduce cost to the care also in future by developing this, by maturing this. And in many sense, artificial intelligence is the ultimate algorithms for healthcare industry in future.
Perfect. In fact, you touched upon profiling. Many of these tech giants are doing profiling, and in that profiling, they're applying that profiling to all lives, all aspects of the life, including if you look at dating sites. It goes to a completely new level, applying artificial intelligence there. So, Sikaji, your comments on AI.
Okay, knowing that we are already 2 minutes over the time.
Right.
So
Ravi is going to raise the red flag very soon,
sure.
but
So
let's take a little bit of liberty there. Yeah.
So as any technology, AI is also a similar technology, yet it is different from programming. It helps human on two dimensions, which we all talked about: A, speed, and second, accuracy. So I'll give you practical examples for which, at least in Medanta, we have been using AI at different stages. I'll take 3 examples from OPD, IP, and diagnosis. So in OP services, we have in OPD consults, we have a smart OPD consult platform. What it means is that based on a doctor and a particular ailment or a disease, it almost fills the complete prescription. So which means that, Anka took an example of 30-40 patients to be seen. So it means 2 minutes. So most of the time, doctor is doing documentation. But what this software does is that based on the machine learning of combination of a doctor and a particular disease, it fills the complete prescription. The prescription has medication, diagnostics, and also the next follow-up dates. So just imagine that complete prescription is almost ready on click of 3 words, that stomach ache, severe stomach ache for last 3 days. Just you have to hear this, and whole of the prescription is ready. This is nothing but a smart OPD based on an AI, which is machine learning on the behavior of the doctor for a particular disease pattern. So this is one example. This is almost this is in production for a couple of doctors who are willing to use this. Second is that because change management is a real challenge. Second, we all know that in diagnosis, radiologists are a rare commodity. So what we are doing is that we run India, one of the largest CSR in the TB. We call this a TB free Haryana. We go to outreach programs, which are like remote OPDs, and carry a mobile X-ray. And in a particular encounter or visit, we have roughly 200 odd patients. This is very, very difficult to read 200 odd patients and find out who has a TB and who doesn't have it. So through a simple AI-based algorithm, X-rays are getting diagnosed with TB or non-TB. We have 98% confidence rate, which means that there are 2% false negative. So which means that, but coming back to whether, you live with 98% success or 2% false negative, I'll say that we'll live with 98%. Third case, which we are exploring right now, is how to prevent or how to come out with the EWS, which is early warning signals in sepsis. We all know that how sepsis are fatal in any ICU environment in a tertiary care hospitals. So we are working on, the sepsis prevention mechanism. This is not a typical SOFA score calculation. SOFA score calculation, according to me, is nothing but a postmortem. So these are the three areas. But just to summarize, not just on the AI or on the IoT or on the machine learning or on the blockchain. See, when you talk about, and I'm just summarizing it, any of these technologies, there are two aspects. One is a operational efficiency. When you talk about operational efficiency, you are thinking about current profit. But the tech which we are talking about are innovative efficiencies, which means that when you invest in innovative efficiencies, you think about future profits. So, all of us, especially in the healthcare, have to think about how do you invest in innovative tech so that your future profits, especially in the private health sectors, are maintained and you have an edge. More so for better outcomes and service excellence for the patient. That's it.
Thank you so much about the use cases and the places that you're already using artificial intelligence and successfully able to see the benefits of it. I will close with a few comments on on where to use artificial intelligence in India as I feel it. With India moving from payout of pocket model to a health insurance model, with universal health coverage being pushed so hard by the government, Ayushman Bharat already has made a big change, and more is coming in terms of the different health insurance schemes that are there in the government, at least from the government side. So what happens is revenue cycle management is going to be the area that will be impacted by artificial intelligence as a first thing, because now when you have to send a e-claim in a standard format, and then you have to populate the e-claim from your existing systems, AI is the best model to do it. When you have to adjudicate it on the other side, AI is the best model to do an automatic adjudication based on a list of rules. And in my opinion, that is going to be the biggest implementation of AI in healthcare in India from a health insurance perspective before the clinical side actually comes in, because the risk is also lesser. Worst case scenario, the claim will get rejected, nothing else, right? You're not going to kill a patient. So that is an area that is going to take off in a very big way. And with that, I would like to sort of conclude, and over to, I see Pratibha already there waiting to take over and saying, that's enough of the discussions, and there are other sessions that are waiting. So Pratibha.
Thanks a lot to all the panelists, especially Dr. Pankaj, for taking it across very well with apt questions, and it was a well-rounded discussion. I would like the discussion to continue more. I would like to listen to all the experts, but we have time constraints here. So thanks a lot to each panelist for joining in, and I would like to just say one comment. It was a perfect backdrop of Mr. Rajiv Sikka, that two robots are really cute. The back. So I would like to present the speaker certificate to all each one of the panelists. Deepa. Speaker certificate, please. Thanks a lot, Dr. Sanjay Goyal, for joining in. Thanks a lot. We are happy to give you an award of excellence in COVID-19 management, the project multi-sectoral COVID management. Thanks a lot, sir.
Thank you.
Thanks a lot. This is a speaker certificate from our side to Dr. Sanjay Goyal for participating in the summit, giving his thoughts.
I would just, Pratibha would like to tell you here before we give the next speaker certificate. We actually, our team, our jury, our team had selected a few award winners. There were more than 65 nominations we received, and we gave awards to some of the healthcare stakeholders. Among them, there were 4 states: Jharkhand, Tamil Nadu, Chhattisgarh, and Madhya Pradesh. We analyzed the work there and decided to award them with the Healthcare Excellence Award for the great performance during this COVID-19 COVID-19 pandemic period. And Dr. Sanjay Goyal, we award you for your great work and your team and the people of Madhya Pradesh you worked with. And it's our honor to award you for that. Can you just share your thoughts on this?
Yeah, thank you, everyone. And I think I can just share that the fight is still not over. So we are like just after this, even on Saturday. So we are going to have a meeting for planning the winter season management. So thank you so much. Yes, it's not me alone. I have my senior and junior MD and other officers also who have worked like who have worked hard, I must say, because I came 4 months back only from US, so they are there for last 7-8 months. So thanks for making this recognition for all of us. Thank you so much.
Thank you, Pratibha.
Yeah, going on with the speaker certificates, we would like to give it to each one of the panel. Thanks a lot, Mr. Rajiv Sikka from CIO, the CIO from Medanta Medicity. Thanks a lot, sir, for coming in and giving your thoughts on the session. And Mr. JP Trivedi, CIO, Rajiv Gandhi Cancer Institute and Research Center. Thanks a lot, JPG. Thanks a lot, Mr. Shubhankar Pramnik, CIO, Columbia Asia Hospitals. Thanks a lot for joining in, Shubhankar ji, and giving your thoughts as well. And Dr. Pankaj Gupta, thanks a lot for moderating the session, the HOD of Digital Health Access as Digital. I had pestered you a lot late evening and in the mornings also. Thanks a lot for all those, understanding and, getting the things well.
Thank
Mr.
you.
Sharat was not able to join. We'll send in the certificate. Thank you.
It's a pleasure
Thank you,
interacting
all
with
the
everybody.
panelists.
It's a pleasure. Thank you.
Thank you.
Yeah.
Namaskar. Thank you so much.